So the Irish social welfare system is based on the UK beverage system. So we kind of started off in the same place. We have social insurance payments that were already mentioned based on contributions, and then also the counterbalancing social assistance payments governed by means test. We have the universal child benefit system, which I think you have here in the north as well. And then we have a number of ancillary benefits in the other. Helen mentioned some of those as well: free travel, household packages with TV license and so on. So some of the features then of the Irish social welfare system, given that that's its structures, is that we face quite a bit of economic inequality in the Irish welfare system. And that's really for two reasons. One is that we have a high number of households who actually aren't in work or aren't making any income whatsoever, so they need to be supported by the social welfare system. And also then we have quite high market income inequality. So people earn quite high salaries, but we've also a lot of people who earn very low salaries. So there's quite a big divergence, and so we need to try and address that income inequality, and that's done through the social welfare system. Secondly, as well as the social welfare benefits we mentioned, we also have services. And traditionally, Ireland has been quite good on the social welfare cash benefits. We're probably higher in most cases than the UK system, comparatively speaking. But our services, I think, are much weaker, and we don't have access to the same levels we haven't in the past anyway, in terms of education and health in particular. So it's been much easier, I think, in the past to put a €5 or €10 on a social welfare benefit than to kind of improve how we might deliver a service, which involves staffing and ways of delivery and so on. In terms of our we have a social insurance system, but in terms of our social insurance system, it's much weaker, I think, than a lot of comparative European systems. So even though we have that, we need to improve it, and we are kind of, I think, starting to work towards that, going in the opposite direction, I think, from the UK, who have now kind of reduced some of the social welfare contributions. So overall, we have this hybrid of universal insurance-based and means-tested benefits.